There's Mary.
Brenda often has problems logging on. I wonder if that's the case today.
She may not feel as much pressure because she's
Visiting.
But that was a good call, Carrie, to invite her. I was thinking
Oh,
to
actually, she had
Yeah.
sent me an email last night wondering about the time. So I said, hey, if you're,
yeah,
if you're free.
yeah. And I think anybody, like, I think I think we should just send out to board members so that they know as well, because it's this is the heart of the matter.
Yeah, exactly.
Just gonna wait for a few more people to jump on. And are we live streaming now?
Yes, that's correct.
Perfect. I wish I could see people that are joining us, but I'm picturing that there's a whole pile of people that are joining us. All right. Well, in light of a large agenda item, a large agenda, I think we will get started, and we will take a look at the agenda. I'm going to start with the land acknowledgement, and first, I'd like just to welcome everyone to the first live streamed meeting of the Toronto Seniors Housing Corporation Quality and Tenant Engagement Committee. It makes me very happy to have this meeting today. And before we start, I would like to acknowledge the land that we're living on, that we're on. As a City of Toronto Corporation, the Board of Directors acknowledges that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. And it is now home to many diverse nations, Inuit and Métis people. The board also acknowledges that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty, signed with multiple Mississaugas and Chippewa bands. I would also be remiss if I didn't actually also acknowledge that today is International Women's Day. And I would like to particularly shout out to all the women who live in our seniors buildings, and the women who actually work in this new corporation, and the women who volunteer on many roles, and the men who support us. So it's wonderful to actually be gathering today on this special day. And once again, in case you're just joining, I would actually really warmly welcome everyone to the live stream, and I look forward to a time that we can all get together and see one another and sit in the same room. But we will continue to actually do as much of this live streaming as well, because it actually, for some people, is actually easier for people to join. So we have an ambitious agenda today, but I think that I said to other board members that I think that this is the heart of the organization, this committee, because without tenant engagement, we are not an organization. And I know that every board member, even those that are not on this committee, are committed to a pathway to meaningful tenant engagement and quality metrics that actually reflect an engaged community that is focused on the voice and the people that live in our buildings. You are the most important part of this. Without you, there is no corporation. And I hope that I know that we have a lot of work to catch up on in terms of engaging people fully. And it's amazing to even think that we're not actually yet a corporation, that we're still actually planning. I would also like to thank all of the staff who have been working from the city and from our new corporation, the transition team, in putting together a tremendous agenda and plan moving forward. So without any further ado, I would like to actually take a moment to look at the agenda and see if the agenda works for the members of the committee, if I can have an approval for the agenda. And I'm going to be looking to Carrie and Jim mainly to approve, and Lawrence, if there's somebody who can approve, or if there's any comments on the agenda.
So approved, Carrie.
And Jim, can I put you down as a seconder?
For sure.
Perfect. And we do want to take an opportunity to make sure that we address any conflicts of interest. Can you please advise if you have any conflicts of interest? Anyone on the board, committee?
No.
Hearing none,
We
will move.
Being a tenant as a conflict of interest because we're all the community members.
Yeah, and we've acknowledged that that's not really a conflict as far as the board, and that's actually probably the most important thing, that we actually have tenant representatives who are on this board. So thanks though for raising that, Jim. And we do have regrets today from Councillor Fletcher, but we have our interim chair, Lawrence, who has joined us, and Brenda Paris, who sits on governance, I think, committee, and we welcome you to the meeting today, and we look forward to Maureen being engaged in the conversation today as well. So without that, I think we have no conflicts. So I think we're going to move on to the approval of the minutes of the meeting that we had. That was our first transitional meeting on January 13th. And I'm wondering if people have had a chance to take a look at the minutes, and if there's anyone who is willing to approve the minutes.
Yeah.
Carrie, and a seconder.
Sure.
Thanks, Jim. See, it's going to be heavy lifting for you today.
That's all right.
And I believe, just a governance question, can Lawrence approve as well? I think he can, right? Do
Yes.
you know, Michael? Yes. So I might
Yes,
just
he can.
throw you into the mix there, Lawrence.
Yeah.
Feel
Lawrence
free to jump in.
is a voting member of the committee.
Thank you. Thank you. So all in favor? Approved. Thank you. So we'll move on to the action item. There was a few action items that were listed. And I believe we have one that's still open. One was a follow-up, and maybe we'll put the agenda, we want to display this just so people are actually able to follow. So we're just at the action item review. I just want to make sure that people have it in front of them.
You would like it shared on the screen, Linda?
I think it might make sense if we actually just have some of these items. Right. What do you think?
Yep. Rajni, are you able to do that, to share the action list on the screen, please?
Just want to make sure everybody is.
Page 11.
Sure. Are you able
Are
to
there any questions, actually, Brenda, Carrie, Jim, Lawrence, on the action items?
Yeah, actually, Linda, thank you.
Okay.
Point 2, which came from an earlier meeting where Sheila Penny was going to provide documentation to show the breakdown of what the building process and outcome was building by building. I know Councillor Fletcher was really pushing for that. What we got in this package was phase 3 only. We got a building breakdown, which did not include phases 1 and 2. So it's, it's not a complete package. And there was some duplication on pages 27 and 28, the same buildings were presented twice. And on page 14, the total for the seniors buildings is 82, not 83. So there's a couple of errors in that.
Right. Do you want us to go back and get have that updated then, Carrie?
Well, I think, as I say, I know Councillor Fletcher was pushing for the complete list. I just think what we have is an incomplete list.
Okay, so we will follow up. So we'll leave that one open and see if we can get the
Okay.
the updated. I wondered about that as well, Carrie. So that's why I wanted to just pause on that.
Yeah.
So Arlene, maybe we can go back to Sheila and just get an update on that.
Okay.
All right. So can
Great,
we?
thank you.
Thank you for taking a look at that. Yeah, so I think that we can move on to the next item. I don't think we need an approval for information unless we want to do that.
No.
All right. So let's get into the to the meat of this. We have a number of presentations this afternoon, and I appreciate all of the efforts that people have made to actually pull this together. The first presentation, I think, Michael, you're going to be leading this on the ISM implementation.
Yes, thanks very much, Linda. And Grant, I think Grant Coffey is the general manager of the Seniors Housing Unit, Toronto Community Housing, is here as well with us, and we'll be able to answer any specific questions. But we thought it would be useful at this point to just give an update on the implementation of the integrated service model. We provided updates in the fall with respect to where this was in its implementation, and of course this is going to be a central part of the work that the new corporation is going to take on when we become operational first in terms of the operation of the 83 buildings. And it has, as you know from our previous orientations, a specific accountability framework working with the city of Toronto, and that will come over from Toronto Community Housing to Toronto Seniors Housing Corporation, as I say, once we become operational. So things have moved along since we last updated you, and if you just go to page 33 in your package, you'll see the four main pillars of the new model. Those are a new staffing model, the development of senior-specific policies and procedures that are aimed at better supporting seniors living in buildings. The third pillar, which we're going to talk about separately, so I won't go into it now, and Andrea Austin is here from the city, and we'll talk about the work that's going on with respect to the consultation on the Seniors Health and Wellness Hub. So we'll deal with that as a separate item in the agenda. And the fourth is the partnership with health and other agencies with respect to the appointment of designated provincial care coordinators within the seniors buildings to support an integrated approach to health and other services that are important for seniors to help them live in place with quality and dignity. On the next slide, you'll see that when we updated you last, that the new staffing model was completed by the end of 2021, and that was phase 1 and 2, and that the third phase of the staffing model implementation is in progress now, launching in Southwest in March and Northeast in April, which is 2 of the 4 regions that we have for the portfolio of buildings, and that this recruitment is scheduled to be completed by the time that we become operational on June 1st. And that also includes the final phase of regional office and staff staff space planning in the buildings and the training for the new staff in their new roles. So that is on track and due to be completed, as I say, by June 1st, when we will take over operating responsibility for the buildings. Again, with respect to the procedures and policies, also you can see on page 35 the extent of the implementation of those policies aimed at supporting seniors in a stronger way in their tenancies in the 83 buildings, in concert with the phase 3 of the staffing model implementation that's also underway. As I say, on the issue of the seniors health and wellness hubs, this is on pause at the moment, pending an extensive consultation with seniors that's being led through the city and a partner, as you can see, Health Commons, contracted to lead that consultation process. So that's underway, and Health Commons are active in doing those consultations, and I've been part of that, as has Arlene, in providing our thoughts with respect to the future directions with the issue of health and wellness hubs, and there'll be a broad consultation with tenants and partners with respect to recommendations that will come back to the board of Toronto Seniors Housing Corporation once we're operational, and for consideration as to the future directions for the health and wellness hubs. And we'll talk a little bit more in detail about that in an upcoming agenda item. The partnerships with respect to the care coordinators are also well underway in terms of implementation now, with care coordinators aligned to 47 of the 83 buildings. The review of partnership agreements with health and social services partners, and looking at the development of new partnership agreements as we become operational as a corporation after June 1st. So on page 38, you can see the timeline there with the phase 3 now underway in the 17 buildings in Southwest and 17 in Northeast, and that will be the completion of the staffing model and in progress as we speak. There's been a significant amount of both advice from tenants and tenant engagement along the way through the development and implementation of the integrated service model you can see on page 39. And importantly, Toronto Community Housing undertook a tenant experience survey, which again we're going to look at separately a little later on in the agenda, and very important information there, I think, that guides us in the future with respect to the priorities through the integrated service model and its further implementation. So that's the update, and I would say in summary, a terrific implementation through Toronto Community Housing and the staff at the Seniors Housing Unit with tenants all the way along the path for the development and implementation of the integrated service model, and with, I think, terrific support from the city as well. We're very much looking forward as a new organization to taking on the role of leading with tenants the further implementation and really seeing the fruits of the additional resource that's available in buildings, the additional partnerships, and really a cohesive approach to supporting tenants in a stronger and stronger way in their ability to live independently and with dignity and with quality in our seniors buildings into the future. So I think I'll leave it at that, Linda, and we welcome any questions that the board committee members have. And as I say, Grant is on the line as well and is course, is leading this implementation at Toronto Community Housing and is available also to answer any specific questions that board committee members may have.
Great, that's a good summary and a lot of work. Carrie, do you want to kick it off with questions? Oh, you're muted there, Carrie.
My apologies. Yeah,
No problem.
thank you for that. Just going back to referencing page 37, Michael, who is reviewing all of the partnership agreements?
At the moment, that, and Grant, you may want to speak to that, that's being done within Toronto Community Housing. And as we take on responsibility for this, of course, we'll be looking at those agreements and seeing how they can best fit the plans for further implementation of the model into the future. But I'll give it over to Grant at this stage to talk about the agreements that are in place and the plans for the future.
Thank you. And thanks, and thank you for having me here to help assist with questions and support the discussion with the Seniors Corporation. So with regards to partnership agreements, within TCHC, there has been a number of activities to look at how the partnership agreement processes can be improved. So during the COVID period of the last 2 years or so, the vast majority of partnerships have been paused when it comes to programming in buildings. However, there has been some essential programming happening over that period to support tenants in some cases. Essential programming being things like food security or health-related vaccine type clinics. You could think of that kind of stuff. However, prior to COVID, in a number of our buildings, there have been pre-existing partnership arrangements to help provide different types of supports and or services to tenants. Some of it is associated with supportive housing type services and what we would generally call exclusive use of space stuff. And some of it is associated more with non-exclusive use or agency-led programming or tenant-led activities as well. The review process of the overall sort of aspect of how partnerships being addressed, that is a piece of work that TCHC has been doing broadly, and we'll be bringing forward some recommendations on things like enhancing the types and terms of agreements, looking at how these partnerships are monitored and evaluated and things like that. In terms of the specific agreements as it plays out for specific buildings and actually programming with our tenants, that is something we're actually looking at it right now, especially with coming out of COVID, and how we can look to have programming in buildings in the near term that will provide some of that needed activity and programming that was there before COVID, for example, to come back. However, we understand and recognize that as an overarching part of the ISM, the approach to programming and working with agencies and tenants and the types of roles and supports that they provide is an overarching activity that still has to be dealt with more holistically. So what we'll be doing is we'll be looking to engage, for example, at the Senior Tenant Advisory Committee on this particular topic to get some input and ideas about moving forward. In the short term, we won't be looking at putting in place any long-term agreements or sort of arrangements at this stage, given the move over to the Seniors Housing Corporation. And in the processes that we'll be working on, there will definitely be a tenant engagement aspect as well, so that there's an opportunity for tenants in those particular buildings to be able to have a role in supporting the conversation about that. I know one of the things that I think we've heard, this is a topic that has been discussed in different places, is that there's definitely a desire to ensure there's the proper balance for agency-led programming in the partnership space and tenant-led programming, and to ensure that the way that the space is allocated and used, there's a priority from a tenant lens. So I think these are things that we've heard. Some of that you're going to hear a little bit later on, I think, on the other agenda item, because it does have a relationship over to, at some degree, programming in the health and wellness space that you'll hear about in the hub concept. So there's also that aspect as well. I know it's a bit of a long answer, but I just wanted to try to cover a number of the angles to it, because I know it is a fairly, a very important issue for tenants, and there's a certain degree of complexity to how it's going to be approached. that we'll try to keep it as straightforward as possible. We recognize coming out of COVID, and I'll just let this table know that the common rooms actually open tomorrow.
Oh,
So this is something that I know tenants have been waiting for. The announcements are going to be going up very soon, but they will be out tomorrow. And we are very pleased to see those rooms reopening as well. So the next stage is to ensure that the programming in buildings where that makes sense and with tenant engagement can proceed at some level.
okay, that's wonderful. Thank you.
Thanks, Grant. And I think one of the key themes there is that, and we'll be discussing this with the Senior Tenants Advisory Committee and with the city, is that any agreements that Toronto Community Housing goes into at the moment in terms of trying to get programming back in the buildings will likely be short term. So that we can
That's
review
great.
them in the context of the new corporation going
Yeah,
forward.
that's wonderful news, really.
Yeah, I think that was my concern as well, and I see Maureen and others nodding their head. I think that you know, having some opportunity for engagement around the principles behind that, and you know, this is the meat of the matter. So you know, short term, is that like a few months? Is that what we're talking about, short term?
Yeah, I think, you know, we're going to discuss this with STAC and with the city, but I think we're talking it's probably 6 months type of time frame. I mean, it's a bit of a balancing act at the moment because we want to get some programming back in the buildings because there's the need and a desire after COVID to get things opened up again. But at the same time, we want to be, you know, consider carefully what the long term looks like for us supporting seniors tenants in a stronger way. So probably, I think, Linda, will be looking at a kind of 6 month time frame for agreements that get in place, put in place now.
Great, thank you.
Super.
And it sounds like staffing, if there's, you know, the other part that it sounds like staffing is well underway in terms of the movement of staff. And it sounds like also that we're well underway in terms of the partnership with Home and Community Care. Do you expect with Home and Community Care that we will actually have a designated person for all of the buildings by the summer, or will that continue?
Grant, do you want to answer that? Are we going to be completed on those care coordinators in all of the buildings, or assignment to all of the buildings?
To this stage, we have 47 of the buildings aligned with care coordinators, and our goal is to have the rest of them assigned by the summer, or, you know, it could be early in the third quarter, it could be later in the summer. And yes, this has been a great partnership type conversation and collaboration with the Ontario Health Teams, the Home and Community Care Support Services group that actually are where the care coordinators come from, and as well with the city. So we are working with them to have that alignment in place, and we're getting a lot of good support to have that happen. As we roll out the final 2 regions this month and next month, and put the new staff in place, the intent is to align those staff in terms of that the alignment of the care coordinators as well. So they work together in processes and actually collaboration to help support the tenants.
With respect to staff, Linda, so all of the hiring with respect to the model as employees will be done through Toronto Community Housing and will be complete by June 1st. And then they'll come over as employees into Toronto Seniors Housing as part of the overall complement of employees who are going to be transitioning on June 1st. So we're not looking at additional hiring as part of the ISM model by Toronto Seniors Housing Corporation after June 1st.
Great, thank you. Any other questions, Jim or Lawrence, Brenda? Yeah, Brenda?
I'm just not clear. The coordinator that you refer to, these are the staff positions through TCHC.
No, I was referring to the Home and Community. So
That's what I was.
CIC. So the good news is that Home and Community Care is now actually identifying a identified person. Not everybody would have a coordinator, but that the building would have somebody assigned.
So would be one coordinator per building or a group of buildings per coordinator?
It varies depending on the size of the
size.
building. Yeah.
All right, thank you. That was all.
That's great. Thank you, Brenda. I think this really flows nicely into the next item. So if we're okay to approve this report for information, I can have somebody to move the approval for information. Carrie, Jim,
Sure, of course.
great, thank you. All in favor? Thank you. Okay, so I think we have a deputation for the before the next item. Is that correct?
I think so.
Do we have Bill lined up?
I'm here.
Yes, yes,
Hi,
Bill
Bill.
is here. Bill Lohman is here.
Hi, Bill. Nice to hear your voice. You go right ahead.
Thank you. Good afternoon, Madam Chair. And that sounds kind of familiar. And QTE members, thank you for this opportunity to address the committee this afternoon. First, I want to begin by acknowledging the benefit and the insight that this committee brings to oversee and ensure that the voice of tenants drives a collaborative unfolding of a new approach and process for a vibrant and successful senior tenant engagement model. Secondly, I've had the opportunity to participate in other projects that Sonia Gaudry was a part of, and I have every confidence that her efforts will present balanced recommendations and a positive pathway forward. I'm excited that tenants are finally getting an opportunity to express their ideas and thoughts about hubs. Tenants do want and need the active engagement, collaboration, and support of agencies through shared use agreements. Seniors simply reject the no access, no say, and the for you but not with you approach. I've sent in, I've added some attachments that back up the what I'm saying here. But why did it take an entire year to bring in this independent consultation to review the hubs when it was announced last May? And you have a document on that. I'm hopeful that this is the start of a return to a sense of normalcy and community spirit in our seniors' lives. Flyers for the event were posted publicly in some buildings and not in others, and messaging for the focus group last week was not clearly presented. The flyer stated the meeting was about the hubs, yet the focus group was about engaging tenants. Having some advanced material that to detail the issues and the meeting objective, like the presentation you're going to see, would help eliminate some confusion, mixed messages, and generate more thoughtful tenant input for consideration. The omissions in this presentation spark concern about the we'll decide what you need to know approach that drives tenants, or deprives tenants of a critical information that they should have for their responses, so that those answers don't coincide with a prearranged plan. This is a continuing pattern that stands in stark contrast to the promised senior-centric expectations sold to tenants and commonly understood principles, values, and lived experience that constitute a senior's lens. Don't you think tenants deserve accuracy in a presentation layout and the proper context surrounding controversies at the core of the hub issues so that they can weigh in and speak honestly to their own best interests? Context, as this presentation will point out, is an important consideration in good, effective decision-making. And consultations that omit pertinent information and relevant context inhibit clear understanding that undermines sound and reasoned tenant input and results in skewed meeting outcomes that delay positive progress. What is interesting is that this city's planned use for senior buildings, common spaces, is nowhere to be found in this presentation or conversation with tenants. And why is that? How can senior tenants have trust when cards that clearly impact the well-being of senior tenants aren't even put on the table for conversation or consideration? I posed a couple of questions, and maybe you'll have better luck getting a response to them. And I'm not going to state them. But even at this late stage of the implementation, why is there still no senior tenant representation on any of these transition committees to have a voice? I mean, are we all just waiting for it to be just the seniors with no Toronto housing anymore? I mean, we have to start including tenants at some point. So my hope would be that it's time for staff to put their cards on the table so that tenants are actually involved in an honest conversation. Thank you.
Thank you very much, Bill. And I'm hoping that through this presentation that we may be able to address some of the concerns that you have raised, and that I'm hoping even more so that our actions going forward will be a reflection of the kind of tenant engagement that you're referencing. I'm wondering, any points of clarification from any of our board members? Bill's very clear. Thank you, Bill. And so I'll pass it over to Andrea. Are you going to kick off this, Andrea? Or are we going right to Sonia and Sophie?
I'm going to kick it off.
Okay.
Thank you.
Thank you, Bill.
All right, thanks everyone. So I'm Andrea Austin, and I'm the manager of senior services from Senior Services and Long-Term Care at the City of Toronto. And I am accompanied today by Sophia Akura and Sonia Gaudry from Health Commons Solutions Lab. And we're going to talk to you about the Seniors Health and Wellness Hubs and the work underway to speak directly to senior tenants on the overall concept of senior hubs. So why we're here today. So we're here to tell you about this project with Health Commons. And the project is to hear directly from senior tenants on their views of on the concept of seniors hubs. So it's very early days in the process. And to use an analogy that I've heard used at this table before, and certainly at the board table, before we start baking anything, we want to consult first and foremost on the recipe. Do we have the right approach to reaching senior tenants? So this is really the kickoff on consulting you on the recipe. And Health Commons has already started doing that, speaking to senior tenants. So what we'll cover today, I'm going to provide some context and briefly, and then I'm going to pass it over to Health Commons to share the plan for the Integrated Service Model Seniors Hub Engagement Project. So a little bit about the work to date. So these are the 4 innovations of the Integrated Service Model. Everyone's seen them before. The Health and Wellness Hubs was originally conceived as part of it. And this is going back to 2019, when our division's mandate was expanded from long-term care and community programs to senior services and long-term care. It builds upon work that was done by Tenants First and TCHC and our division, as well as independently funded evaluators and researchers, engaging senior tenants living in the seniors housing unit through focus groups, interviews, surveys, and tenant information sessions. So we don't want, it doesn't start from scratch exactly. It builds on what we've developed to date. And this engagement has led to the development of this ISM concept in the 4 innovations. And it was, I think it was developed in earnest and getting feedback from seniors that they want easier access to services, including more services that are closer to home and inside their buildings. So that was where this idea came from. A little bit more on the original vision for the hubs. So the original idea was to pilot a few hubs in some of the senior tenant buildings and work with local community support service agencies to offer health, social, recreational, and other programs right in the building. So for example, the community agency might set up in the common room and work out of there, might offer services out of there, and with which the tenants living in the building and other tenants in the neighborhood could access. So the original intention was to try to improve access to services, help with food security, access to recreation, reduce isolation, and strengthen community connections. So a little bit about the timeline. So there was work underway in the summer of 2020 around 145 Strathmore. Then there were some significant tenant concerns that emerged, not just about 145 Strathmore, but about hubs generally. And then council directed us to put it on hold. So it has been on hold for some time. And then in December, council directed us to really restart the work through this independent review, which you're going to hear about more today. So we can move to the next one. Thanks. So in winter of 2020, the TCHC Seniors Housing Unit, so SHU, under Grant's leadership, started to work with a community local agency to identify a site for the first hub, which ended up being 145 Strathmore. And there were a number of reasons why we went ahead with that. But in May of 2021, at the Tenant Services Committee meeting, there were deputations that raised significant concerns about the hubs, particularly inside their buildings. So inability to access the common room, security concerns, including people who are not tenants having access to the building, and just a need overall for broader and deeper tenant engagement. So next slide. So as a result, the work on the Seniors Hub at 145 Strathmore and hubs in general was paused. And then, as I said, in this past December 15th, there was a members' motion passed at council, which directed our division of the city to lead a review of the Seniors Hub's model and remove 145 Strathmore as a potential site. So hopefully this goes to some in terms of answering something, Bill's concerns to some degree about the delay. And then preparing to review the hub's model. So we worked to find an experienced and trusted community partner to lead the review and come back to the board with recommendations for your deliberation, for your consideration. The Health Commons Solutions Lab was selected, given all of their experience with community engagement, city and experience working with other municipal government and community projects. We're happy to talk more about their experience. And we're really confident that Health Commons can lead an effective and trusting engagement process with senior tenants and other stakeholders to help the city and TCHC, which is morphing into TSHC, to decide on the next steps for seniors hubs and that element of the ISM if we move forward at all. So we'd like their review to inform the city and TCHC and TSHC planning around this senior hub component of the ISM. And as I said, we are going to come back with Health Commons to the TSHC board in June with the recommendations from Health Commons for their deliberation and consideration. So I'm going to pass it over to Sophia Akura from Health Solutions Lab, who can lead you through a more detailed overview of what they are planning for the engagement.
Thanks, Andrea, and thank you to the committee for having us today. I recognize many of the faces that are on screen now from previous work, but also from our consultations in the last week and a half. So I apologize for any retread that you might experience here as we are going through the slides. You might hear some of this stuff for the second time. But we did really want to provide a little bit of an introduction to who the lab is, so that I think neutrality is a critical aspect of the selection of Health Commons and doing this work. And we wanted to explain to this committee the way that we approach the work, what some of the outcomes have been, and hopefully that will fill in some of the gaps around how Health Commons plans to work very closely with seniors in Toronto community housing buildings to explore some of the questions and the themes that have been raised. So just very quickly, I'll give you an overview of Health Commons. We're a not-for-profit social and health innovation lab. So the work that we do is we take a multidisciplinary team out to speak directly with those who are most impacted by our systems, and often most impacted in negative ways when our systems are failing them. And we are looking very specifically at finding ways to improve equity and improve people's experiences, their well-being, and their overall sense of health. And so we will work directly with individuals, seniors, and communities to hear their stories, listen very carefully to understand some of the themes around how is their lived experience going to be able to really inform the design of whatever policy solution comes forward, and to test those ideas with them. We have a mixed team, some epidemiologists, we've got some designers, we certainly have some people who are health policy experts, and also individuals who have been doing community engagement and community research for some time. And as a practice, we always begin with just designing the purpose and the problem statement directly with citizens and with individuals. So I'm going to go to the next slide. I wanted to share a little bit with you about how we go about our approach. So we are always looking for ways to balance what we know are the needs of people, their individuals' needs, and also the achievability of meeting those needs with the system priorities and policy goals. So we all know the realities of, you know, the boundaries of the dollars that are available to us, the resources and the assets that we have. But often we find people can help us see assets and new opportunities that the system may not have previously seen. And we find that those stories and listening really closely to what people have to say often reveal a whole new set of opportunities that were previously unexamined. So we're always looking for that balance between what the system's priorities and stated goals are and what the needs and goals are stated by individuals. And in between, we'll look at things like readiness. We'll listen very closely to what has to be true for seniors. We'll look at their objectives and the decision points for them, and also some of the tensions that exist in the spaces, right? So often, you know, we think about tensions like the decision points we have to make. You know, some seniors may speak about the challenges of going to services that are further away from where they live, while there's also a trade-off being made if you bring them directly in the building, and what that might mean for the place that you call home. So we'll be trying to surface some of those tensions and really understand the breadth of perspectives. It's important to us that we hear from people on all ends of the spectrum, and we tend to go very deep. So this isn't a broad survey kind of approach. We're not going to be asking yes, no questions in a survey style. We go very deep into conversations so that we can really hear people's stories. I find it's often useful just to share quickly an example of how we have worked, so you can hear from a different sector some of the work that we've done in the past. So I'm just going to tell you a little bit about our work during COVID. At the beginning of the pandemic, we could see that there were communities that were very specifically impacted by COVID. They had much higher rates of spread, and there were much higher rates of morbidity, so death in those communities. But the explanation for why those communities were differently impacted wasn't clear at that point. It was still May, I think, of 2020. And it was necessary for us to understand how the system was responding, but also what was happening in those communities. So we knew that at the time, the best way to stop the spread was to give people access to testing, and people tested positive to ask them to stay home and isolate to prevent the spread of COVID. We took a team out to North Etobicoke in Toronto, where there were very high rates of COVID, very few testing options, and asked people what was most important to them. And what we heard back from the community leaders and also individual citizens was more access to testing. But when we went a little bit deeper in the 140 interviews that we did, we also heard stories about people having to make very difficult decisions, trade-offs about, if I get tested and I test positive, I really can't afford to stay home from work for 2 weeks. I may lose my job. I might not be able to pay rent. So the policy goal of identifying people with COVID and asking them to remain at home was really jeopardized by actually something more pressing for these individuals, which was housing insecurity and food insecurity. So being able to sort of gather those insights and also other insights around who are the trusted sources of information allowed us to bring back a multi-pronged approach, a three-pronged approach to the provincial government, first to the city and then to the provincial government, about a way that we could better serve these communities. And it included hiring community ambassadors from those communities who are already trusted sources, who understood the day-to-day experiences of individuals in the community and could help us bridge the gap between how information was reaching people and what they needed to hear. It also involved bringing testing into those communities and really supporting individuals who tested positive. So financial support to bridge them to CERB, food drops, psychosocial check-ins, and even just going into an individual's home at their invitation and finding ways to ensure that people could isolate safely with their families in place, and stop the spread even within their own homes. So that's one example of the way that we listen to the stories and bring them into the policy space. I think one of the good news stories of that work was that since then, the province has put over $60 million into that initiative. And we have found communities respond with a really vibrant and very creative ways of ensuring that people can be kept safe. We saw a lot of pop-up clinics happen with vaccines. Those are also a direct result of some of that work. So I wanted to share that example so you could get a feeling for how the lab works. And then if we can just advance the slide, I'm going to tell you a little bit more about our process. So we recognize that there has been a process that has happened before this, and we want to honor those conversations in the work. Recognize everybody has worked very hard on, both in creating the concept of the hubs and also in advocating for the need for a pause and to look more closely at what this impact might be. And we understand that hubs could create a sense of community and maybe reduce isolation, that there's the possibility that we might be able to bring supports closer to home. But we also understand that it may foster a feeling of feeling unsafe at home, and also using spaces that are really important to the tenants that live in those buildings. So our goal is, through an engagement plan that we design with seniors, that we're going to speak with seniors very specifically about some of the objectives of the hubs, really trying to understand what is required to feel safe at home while also having supports close to home. Understanding the range of perspectives on access to services and also social spaces. What do people want? How do they prioritize their needs around this? And we really want to hear folks share their perspectives alongside the stakeholder consideration. So we're speaking with seniors and also some of the stakeholders who've been in the mix. There's a number of questions that we think are very worth exploring. And I really want to reassure folks that we are in no way committed to the concept of hubs, but we are committed to ensuring that seniors are getting their needs met, and in ways that work for both the service providers, because they have to be in those spaces, but in particular for the seniors who live in these buildings. So I wanted to bring that forward. The process that we're following, if we can go to the next slide. Thanks. So right now we're in that sort of build phase, and over the last week and a half, I believe we've spoken to Sonia, can correct me, spoken to 21 seniors in 4 focus groups. And the purpose of these first focus groups is just to talk to people about how we should be putting together this engagement plan. And one of the first things we heard was, don't call it an engagement plan, and how engagement, the word itself, is actually quite loaded and has not been a positive experience for many seniors. So even just those kinds of insights really help us to ensure we're not turning people off, as we step in the door. But we also wanted to hear about how to reach the diversity of seniors that are living in social housing buildings, a little bit about just the context and individuals' perspectives, a lot about the approach. And we heard a real commitment from members of the STAC and also board members who are also tenants, about a real desire to make sure that they're being representative in the views that they share. I know there's an acknowledgement that when you sit on a committee, you can sit there as an individual, you can see they're representing a broader group. And I think there's a real commitment on the part of those individuals we spoke to this week of being able to broadly represent their constituency. So this is the stage that we're in. We'll be moving into the listening phase, where we're going to go out and talk to seniors about how they're feeling about hubs and access to services and what they want. Also a little bit about what their days look like. And then we'll be taking all that information in, and we go through a process of just generating insights. That involves us looking for themes that we've heard have been repeated in multiple ways, and then trying to understand what those themes are telling us. What are people saying, even if they're saying in a variety of ways? What's the general truth that we can extract? And we'll be presenting those findings, including some sketch out of the possible solutions that might happen, what would need to be true for those solutions to work. We'll be presenting those back to the TSCH board meeting in June. So hopefully that provides you with a bit of a summary. Wondering if there's any questions.
Thank you very much, Sophia and Sonia. And I have had the great opportunity to work with your team previously, and I think this iterative approach may actually address some of the questions that Bill had. That you can make advancements as you go in terms of hearing from people and listening to what people are saying. But I'll open it up to other board members. Are there any questions that people have or comments at this point? It was good to have the history too, Andrea, because this has been a little ways coming.
Yeah. I just
Go ahead, Carrie.
Yeah, I just I enjoyed the earlier presentation too, Sonia, and this was not, completely repetitive. It was great information. I just think the fact that you're not wedded to anything, that you're approaching this with a completely open mind to say, let's see what the research dictates, should happen. I think that will be welcome news to tenants who I think too often feel that the structure is already in place and we're being asked to comment on something that's already been formulated. So that's particularly good news.
Thank you. And maybe I'll
Brenda has.
Yeah, sorry, because my layout isn't very good right now. Brenda, thank you. Thanks, Brenda. Go ahead.
Thank you very much. My reason
can I just suggest we stop sharing the screen?
Yeah,
and
because
everyone
for some
can
reason,
see.
thank you.
Yeah, there we go.
Perfect. Thank you.
Oh, great. Thank you very much. My main reason for attending today was going to be your presentation. I'm not a member of the committee, though I'm very, very keen on the issues of tenant involvement in the housing sector and our responsibilities as well. My first comment is just a question, and I don't know if is it Andrea from City Hall? Yeah. Something that in the presentation that was new to me, and that was the idea of the hubs being improving access to services for people in the community-based seniors, as distinct from building-based. Was that one of the purposes and the concepts behind the idea of the hub model?
Yeah, so this is something, again, that we heard when we consulted, we did consultations to inform the development of the Toronto Seniors Strategy. We reached 3,000 people in person, and a third of those were in Toronto Community Housing Seniors buildings.
Right.
So these were some of these ideas came from. There are some places in the city where there's a seniors building and there's a city recreation center or an AOC right down the street and they're well served. Then there are other places where there's a building and there isn't a lot around it. So people said, what bringing people in to either dead space or sometimes unsafe space might be healthy, generate these kind of animate the room, create these connections for seniors. Again, it was something that we heard of, but are now really doing the work to talk to seniors to see whether that is a good idea or not. It was just something that we heard when we were doing the consultations.
I can appreciate that. I have some experience running hubs and interagency collaboratives, and my main concern here has always been, is the hub a solution in search of a problem? And I always think the issue is, let's define the problem, and the problem is people's need for services and quality of life stuff, aging in place, and all those goals and purposes and beliefs can happen in different ways. Okay, if you're wedded to just one way, it may not be suitable. It's also perhaps underutilizing of other community resources that could be tapped into with improved working relationships. And my experience has often been, what often is a solution is people being more professional and actually engaging and working collaboratively. And that work of collaboration is something that takes a lot of time and a lot of work and is often not understood or overlooked because everyone works in silos. Health people are in silo from social service, people are in silo from recreation, and never the twain shall even talk, let alone meet, let alone work together. So my main interest here, and it's a particular interest, and I'm going to nudge everyone on this, is the suitability, because hubs can often just be rental relationships.
Mhm.
You know, someone's got the building space, but it doesn't mean there's engagement. It doesn't mean there's socialization and improvement. It doesn't mean it's allowing people access to the outside world as they get increasingly isolated and increasingly frail and vulnerable. And it's just almost like a sledgehammer in a sense. And so I'm very, very keen on the consultation. I hope you will look at other alternatives. It seems to me your terms of reference are really not that broad. So let's be careful that we're not having great hopes here, because it seems to me you're still, with your terms of reference, looking at the issue of hubs in relation to the integrated service management. And I may be wrong in my interpretation what I read, but I just want us to be very careful, because you can often end up with a report that just validates what was talked about beforehand. And I don't mean to prejudge or prejudice in my comments, but just my sense is people aren't necessarily against hubs. It may be the way it was introduced, and it may be, well, what is the hub going to do? You know, and I take very seriously the issue of safety. I'm a mother of a disabled adult son. I've had to deal with the failure of systems to serve him at cross purposes, and safety and security was a big one. You know, typically when you're disabled, you get lumped into the other housing, right? And the other housing increasingly now is a conglomeration of multiple needs. And I personally don't think multiple needs people should be all dumped together, and that we assume in this marvelous world that everyone's going to be happy. So, you know, when the drug dealers come after your son, and both the police and the agencies and the housing providers will do nothing to ensure the safety and security, I know exactly the baffle gap that seniors are going through, because I've lived this. You know, where the police won't intervene until you actually see it. The management won't intervene because, well, you didn't see Bill do that, right? Now that drugs are legal, marijuana is legal, everyone's hands off because they'll say it's now legal. Well, it's only legal in certain prescribed ways. And using a senior's apartment as a drug distribution point is not legal, no matter how you cut the tamales, right? So before I would suggest that we open the doors of our housing, seniors housing units to outside forces, there is not going to be any front office staff that is going to be gleefully opening the door to individual people. And anyone who even thought that needs to have their head examined, because you're under-resourced as it is. Do you actually think that city staff are going to be opening the door to each and individual client who wants to come into the hub? You know, I mean, I have problems with that with our condo because we don't have a concierge, right? So why on earth would we expect that this is going to happen in an under-resourced housing location and where people have no control over the comings and goings? So I'm happy to see you're on board with your team. Happy to help in whatever way I can, but certainly I see my responsibility as a board member, and I'm not on this committee, but certainly as a board member, to ensure number one, safety of folks in housing and safety and security, and to try and get around this baffle gap that we often engage in, where we throw out solutions because we think we know the problem, but we still yet haven't defined the problem.
Thank you, Brenda. I'm so glad you came today, and this is actually relevant to I think that our committee is part of the board. This isn't actually a separate activity from the board.
Right.
This will actually be, coming to the board, and all of the board members are actually welcome to commit to it. And I saw Andrea and Sophia nodding as you were speaking, and I think that, do you want to just comment at all?
I mean, yeah, I think Brenda is right on. I spent 20 years working in the health policy system for that period of time, what I found was often missing was a real definition of the problem we were trying to solve for. And actually, in the space of a really complex population with multiple things happening at the same time, that problem is often defined over here and then over here, and they're not really connected. But we have found that individuals can actually tell us what the highest priority problem you can address is within that range of things. They sit at the nexus of a lot of complexity, and they can actually simplify the problem statement for us. Once we really understand what's going on, they are able to really help us with that prioritization exercise around what's the hierarchy of needs that you need to be serving. And also, I think, surface what would need to be true from an individual's perspective for them to be able to benefit from whatever policy is being brought forward, because often we assume that if we put the offer out there, that's all that we need to do. And there's a reciprocity that needs to be built into our policy solutions so that everybody's benefiting and getting out of it what they hoped to get out of it. So the way that you are describing this, I think, is really consistent with the way that we wanted to come at the question. I didn't cover it in the last slide in the deck, but you can see it. This very early stage is just really trying to unpack some of those things. How can we make sure that we are getting a really broad representation of the question that we should be asking, and where should we be going to ask that question, and how should we be doing it to be able to get a really robust understanding. So hopefully that, if you have more questions about our process, I can answer some. Sonia is.
And further to that, Sophia, I've also had a policy background, and there's a tremendous sense in which BAFLGAD gets involved with this. We know generally what seniors need. This is not rocket science. I mean, there's endless amount of research and qualitative research and talking to people. This is quite simple in terms of what the problems are and what, we know how to meet them. It's just we've never put the resources towards it. So,
and we have heard that people want to actually engage with us, so that we're not just actually coming up with a model, right, Brenda?
Yeah, yes. So I just want us to really be grounded on this, that, there's lots of research on social isolation. Our lived experience with COVID, my sister's in a seniors building, and there are actually a huge increase in deaths, not just depression, but deaths. So for the first time, her housing, it's independent living, actually has vacancies. Who's got vacancies in a city where people are, needing housing? But that's because people are literally dying because of the social isolation, So, there's lots of practical stuff out there. And as I say, this is not rocket science. What is important is engagement and building of community and building of relationship. And that's the key for this to be sustained, as well as proper resourcing and proper allying of the professional resources to collaborate and actually work together, be accountable to each other. If you say you're going to do something for the client, make sure you do. And I have the right to call you as that client's worker or assistant and ask for your accountability to make sure you did do that job. That's what's missing. And that's why you got to focus on collaboration of the people who are paid to do these things.
Thank you, Brenda. I really appreciate your comments, and I think it reminds me why we actually went into this. It was a big deal to actually take all the seniors buildings out of Toronto community housing, and the whole idea was to actually provide a new innovative model where services were available and tenants were engaged and senior friendly communities. And I continue to see this as a good news story, that if we can actually stay on a path of getting it right and engaging people. And I know that you both are coming from this. Any other final comments, just because we're going to move on to the next section, which is actually hearing a little bit more around some of the feedback we have been getting. Jim, did you want to add anything, or Lawrence? I saw a thumbs up, which made me feel good from you, Jim.
I think that one of the things that is really missing during this whole pandemic is a cost-benefit analysis of the lockdowns and the things they've been doing. My daughter was scheduled for surgery in November 2020. Surgery this year in January. And she had 3 doctors saying that she's going to go blind if the surgery doesn't. And it was as if like everything else the government does, they do a cost-benefit analysis. The laws, like seatbelt laws, all these different things, People are going to die if they don't wear a seatbelt. People are going to die if they do. They do a cost-benefit analysis to find out, is it worth it to pass this law? But that wasn't done with COVID. It was just, we're going to pass these things and we're going to lock people down, force them into isolation, and create a whole subdivision of numerous problems.
Yeah, you're raising, you and Brenda have raised really good points. Thank you for sharing that, Jim. I think that, I think you're raising also the context of right now. Like, if there's some urgency, we are coming at this at a time where poor people and people that were isolated were impacted greater during COVID. So it's a good reminder, and I feel confident that actually that the partners that we've chosen to lead this actually have a really good appreciation for that, and thank you for the presentation.
I feel the same.
Thank you, Jim. So I'm going to ask for an approval for this presentation for information, and then we're going to move on to the next one. And I want to thank Sophia and Andrea, and I think Sonia's on the line and as well, for coming and for engaging with us. This is really exciting, and I think we all look forward to actually hearing your presentation. It's not a group that's going to take it lightly, so we're going to actually hold you accountable, right, Brenda? An approval, Carrie?
Sure, yes, absolutely.
All in favor, Lawrence? Great. Okay, so we're going to thank you again, and we're going to right now also hear from Arlene and Maureen, who's a member of our STAT committee, on some of the engagement that has been happening with our seniors. And I'll pass it over to Arlene, I believe.
Hi, good afternoon, and thanks for the opportunity to present the findings of our tenant survey and focus group that we held in January 25th and 27th of this year. Rajni, if it's possible to bring up the presentation, and while you're doing so, I just wanted to first begin by thanking Maureen for agreeing to participate today and to share this presentation with me, because she was an integral member of making these focus groups a success. And she stepped up as a member of, as a tenant rep and a member of STAC to help us plan what we were going to say, and also help to facilitate the session. So it felt good and right to ask her if she could come and also present the findings to the board committee. I would just like to note that we would be talking about the information at the highest level in the slide deck. There's more detailed information contained in the appendix, which I hope that you had a chance to go through, but we just wanted to present our findings to you so that you had an overview of what we found. And then, and I want to make sure I give Maureen time to provide her comments as well. So Rajni, if we could go to the tenant focus group report, please.
Yeah, it's the next one, I think.
The next one, Rajni. Yeah, thank you. So while that comes back up, I just wanted to ground us in the reasons why we had the focus groups, and it was to gather input on the service delivery priorities identified in the ISM Phase 1 Tenant Experience Survey for Toronto Community Housing. And we've heard a bit about all the work that's been done in the ISM already today, but we wanted to use that to ground us into getting input as to what tenants wanted to see for the priorities for Toronto Community Housing, for Toronto Seniors Housing moving forward. So that was one of the key objectives that we wanted to make sure we got out of our meetings with tenants. We also wanted to provide them an opportunity to validate what was gathered in that survey, and then enhance the findings of the original survey, and then give us some direction in terms of here are the priorities that are important to tenants moving forward. So in the midst of having those conversations, we were able to hear from a number of tenants. But before I get into a bit of the details of the survey, perhaps by way of a background, there was in the original ISM survey that was done in 2020, there were 18 buildings in Phase 1 that participated. And actually in the design of that survey, Maureen was intimately involved in designing that survey as well. So she's seen the survey from design to execution, to now being utilized to inform the work that Toronto Seniors Housing is going to do moving forward. And so it was great to have her there, and we leveraged the data from the original survey to gather perspectives from the new focus groups to see if what was found in the original survey still held true. The survey topics that were covered originally included property management, safety, security, communication with staff, access to support services, community development, tenancy management, and general satisfaction. So it was some pretty important topics that were covered for the original survey. And in the way we approached this particular work was by ensuring that we had 4 regional focus groups. And we invited tenants from across all 83 buildings to participate. And then they chose which regional focus group they wanted to participate in January. We used the findings we gained in January to inform the survey that was sent out in February. And now we're bringing forward the priorities that they identified in March. In terms of participation, we made sure that we involved staff from the very beginning. So we got got input, asked for input on the agenda and things like that. We also did a bunch of postings in social media. We did a number with the support of Toronto Community Housing. We also did postings in the building so that people were informed. And in total, we had 23 responses to the survey and people participating in the focus groups. And while that may seem like a limited number of people to have engaged, I guarantee you that the people who were part of those conversations were very, they really provided terrific input and terrific insights into the work that we needed to do moving forward. So the next part of the presentation is going to talk about what we learned. And what we learned comes through a senior tenant lens. And to that point, I would love for Maureen to help us talk about what we learned through the survey and the focus groups. Maureen?
First of all, I want to just thank you, Arlene, for asking me to take part in this, and thank you all for having me here today. It's my pleasure to represent as many tenants as I possibly can, so thank you. I don't know what's happened with Rajni in the slides, but as you said, there were, I think, 7 areas they were broken down into, and the first one involved property management. I don't know whether I need to read through all these priorities or if Rajni can get the slides up or not.
Maureen, maybe we could go to the themes because it might be easier.
Themes meaning?
The key themes. I can't see the slides. Just let's maybe take a pause for a moment. Is it possible to get the slides? Oh, great. Thank you.
Thanks, Rajni.
Terrific. It's just easier when you got them, right, Maureen? And we so appreciate you being here.
Appreciate you being here. So we're going to look at the key themes, Rajni, which is further up in the deck. Before next, what we learned and the key themes.
Okay, key themes.
Thank you so much. There we go.
So the key themes, the areas for improvement identified in the original survey are still valid and need addressing. The second one was the need for health, wellness, and day-to-day living supports that was heightened by the pandemic, and isolation and mental health supports are very important and were also heightened by the pandemic. Tenants need help preparing for services such as pest control, as they cannot remove and replace items on their own. And I'll add more to that as we go through the breakdown. And senior tenants would like staff to better understand the ever-changing challenges of aging. Consistent staffing helps seniors feel more secure and helps to build trust. And there's a lot to delve into on that, which we won't do today. And looking at the lived experience for those who are able versus those who are less able, because that lived experience is quite different. It covers quite a broad range. Common spaces for tenant activities is important because it builds community and reduces isolation, which we've all recognized as important. And everybody's chomping at the bit because of the rec room closures, which is now going to open. But now we have to sort of keep a watchful eye on to make sure that common spaces are available for tenant-led programming and not just agency-led programming. That's our next challenge. And language barriers continue to impact tenants for whom English is not their first language. And I know some effort has been made to work on this. A little bit more needs to be done because we're still getting posters that say at the bottom, if you require this in a different language, please call this number, but it's written in English, so it doesn't help. And then there's the recommendation study. Do you want to talk to that, Arlene?
Happy to. Thanks, Maureen. So the roll up in the last two slides is a consolidation of the information that you'll see in the appendix. But this is what we've done here is taken all the recommendations in the top three in each area and color coded them so you could see what areas of the business would be affected by the changes that are being asked for by tenants. And then the gray space denotes the conversation that we've had with Toronto Community Housing around what is the art of the possible in the first 100 days and beyond in terms of addressing these areas of concern for tenants. So for example, in the area of group activities and interactions for mental health. Everyone's keenly aware, it's been said numerous times on this meeting call alone, the need to reduce social isolation and offer interaction opportunities. And I know that this is high on the agenda at Toronto Community Housing, and it will be high on our agenda as well. And so these are areas where we feel each of these areas can be addressed in the very, very short term of starting up Toronto Seniors Housing to signal to senior tenants that the areas that are important to them, the areas they have identified as priorities, can actually begin to see some traction moving forward because Toronto Seniors Housing Corporation is here to meet their needs moving forward. The areas that are not highlighted in gray, those are areas where there would need to be some longer term solutions developed, but it is in consultation with Toronto Community Housing, it is possible to address some of the areas that have been noted in gray to see some immediate action within the first 100 days to improve the quality of life and the quality of safety and security for senior tenants.
Can I just add a point to that, Arlene?
Of course.
These are all issues that tenants have raised, and although the numbers that participated in the focus groups was not high, it can be said that it did cover a very broad area. All 4 regions were represented, so that's a good thing. But in the past, I think what has happened often is that Toronto Housing has looked at some of these needs, and decisions have been made around how to address these needs from a management level. And the big piece that's always been missing and that we have to watch that we don't carry on doing, there needs to be a building by building assessment done. One building might really need CCTV cameras. Another building might not. Pest control is broad, that covers everybody, but it's not just the assistance with the heavy lifting. A whole new system needs to be developed. Social gatherings, I mean, you need to look at each building and how much space they do or don't have available for these social gatherings and community activities. So before saying we can address them, each building needs to be assessed.
Thank you.
So that's what I wanted to add to that.
Thanks, Marie. I think that's important because we heard thematically from the input we received. There were buildings that said, you know, we have 100 CCTV cameras and we don't feel insecure at all. And then there were buildings that said, yeah, I would love to find 1 or 2 in the right places because I'm afraid to walk out my back door or to walk the, the hallways and people can they can, piggyback on you coming into the buildings because there isn't enough security for access. So I think what Maureen raises is a very good and important point. And I think one of the things that we did in the conversation with tenants in January was to clarify that we will begin to work on these areas of focus moving into Toronto Seniors Housing in the first 100 days. The solving of these problems will not happen in 100 days. There will be a continuous work in progress. But it really helps us to sharpen our focus to say, these are the areas of concern. Now, how can we address them, and how does it diverge depending on what building or what area you're in? So if we could move to the next slide, please, Rajni. In terms of next steps, we're bringing forward recommendations to the board from tenants on the TSHC priorities for the first 100 days and beyond. A short-term action plan would need to be developed to address the priorities. Then we want to make sure we close the loop with seniors and on the findings and tell them what's coming up next. And then we would recommend that the new leadership team to include these priorities into the longer-term strategic planning work, because while we can start some of this work, as we've just said, if there is some longer-term implications, and we're not going to solve for 83 buildings with every single problem in the first 100 days alone. So just thank you, Madam Chair, for the opportunity to present. If there are any questions.
Thank you, and I'll open it up, and I hope that the next steps will include having Maureen and others engaged in the in this work, and maybe that's one of the recommendations that ongoing we actually have that as per Bill and others comments in terms of a meaningful partnership. And I know Arlene has so appreciated your input, Maureen, too. Thank you so much. Any questions, Carrie, Jim?
No, it's very, very, very clear, very clear. Particularly Maureen's point, I couldn't agree more. There is no one-size-fits-all solution.
Yeah, and but I think these will help us to actually confirm some of the priorities. And I think people,
absolutely,
knowing that that you're out talking to tenants. Brenda, I see your hand up.
Yeah, mine's a technical question. Has there been a survey of all the 83 buildings to look at things like what space is available, what safety issues might arise in that building? I'm very cognizant of Maureen's point about building by building assessment, and I'm really keen on that as well. I just wanted to know if there's a baseline of information that we might have to begin with. Is that available? Has that been done? I don't even know if it's been done. So I'm just.
I don't think so.
So
okay.
I
don't think so, Brenda.
Okay.
I can't say for sure, but we could take that away as an
in a
action.
comprehensive way with all those categories. Michael, do you have any comments on that? Or Maureen, go ahead.
Sorry, to my knowledge, there is no baseline set of information.
Okay. And
so
then
add that.
Yeah, well, it just seems to me you can't, we got to see even what the physical space is that is available, right? And second to that, of course, my brain just went dead as I started to say that. Has there been any discussion, and I don't know if there's any city people here. Who's here?
Grant. Well, Grant is
Grant. Okay. I don't know. Has there been any consideration to the wild idea of having each individual building be self-sustaining and run on its own with its own board of management directors, advisory committee, almost like a housing co-op board? Has there been any thought at TCHC to that as one of the proposed models? Because that's certainly the way they're going, I believe, in some of the housing solutions in England and maybe Vancouver too. So has that ever come up? Because some of this control and involvement and engagement can perhaps be facilitated by a different managing of building resources. So has that ever come up in any city examination or public presentation or comments even from the community about that?
From my perspective, having been on TCHC, I don't think that model of actually having each building having its own management structure has. However, the whole engagement process has actually been to actually foster some kind of model of tenant engagement specific, and the division of the buildings across the city into actually the 3 different areas was actually trying to get at that with some economies of scale as well. But Michael, do you want to add anything? Because maybe Grant's not available.
I don't have I don't think we've got anyone from the city here.
Yeah.
But certainly, the issue of how tenants associate within buildings. So I'm not talking about management structure, I'm talking about tenants and how they organize themselves.
Yes.
In the end, is up to tenants.
That's right.
They're tenants in the building.
But we've not had a model that would facilitate a building by building advisory capacity, or a structure where, I mean, for example, even simple programming of whatever space is available, whatever community space is available.
There certainly have been action plans developed within buildings in terms of the priorities for those buildings. And Grant, I'll just ask you to very briefly talk to that, because we're a little ways behind in the schedule here.
Yeah.
And then
And
we'll
no,
move on.
thank
if
you.
that's okay.
Sorry, my apologies. So that model that was just discussed hasn't been something that I'm aware of that has been discussed within TCHC either.
Okay.
I just wanted to just comment really very quickly. We are looking at doing an inventory across the spaces in the buildings and gathering that. That is a piece of work that we're actually starting fairly soon, and to actually get an inventory of common spaces and amenities in buildings. The other thing is there are safety audits that are done periodically on buildings.
Yes.
That look at a number of different aspects. A number of buildings have those in place, but I don't have an overall summary of exactly how many of the 83. So we could follow up on that.
Grant, could I also add, for your inventory of common space, could you also look into whether there is office space or lockable space that could be available? For example, in the better shared service things that I know, when the PSWs, instead of just being outside agency people, if they're specific to the building, then they'll need an office space to gather in, or, you know, check in at. So including your inventory, if you could include not only the common space, but the possibility of office space available to either outside agencies or internal organization. If you can include that in your inventory, it'd be great.
Yeah, no, I believe we've got that in scope, but I'll go back and double check that. So
All right.
Good point.
Great.
Thank you.
Thank you. Maureen, and then we're going to move to the next item.
Yeah, I'm sorry, I'll be quick.
Oh, no, please do. Go ahead.
I'm quite interested in Brenda's comments, and I would just like to suggest that as we move forward, working on a new tenant engagement system, discussing these self-sustaining communities would definitely be worthy of having a part of that discussion.
Mm-hmm.
Thank you.
Not to be a total Bolshevik about these things, but it just seems to me there are oodles of models where this is done. That's what I'm saying. We don't need to recreate the real, and you can give a limited authority or whatever to each building. And why on earth should someone head office decide how to use the space at 101 Jones Avenue? You know, I mean, really.
Yeah, I think that was some of the intent, was that to actually have those kinds of decisions made at a local level. But let's I think what we're learning is that the tenant engagement process is actually complex, and that it's a good reason that we actually have some people that are helping us with some of this, because it's there's some uniqueness that we have to take into account, and not everybody has the same opinion on all of this, is what I've learned. But if it's okay with the group, I'd like to actually move from this agenda item and thank Maureen and Arlene for providing that overview of the tenant information. I think that will hold us in good stead for as we get started in terms of the 100-day priorities. Can I have someone to approve this report for information, Carrie?
Of course.
And all in favor? Great. And I think at this point we're moving into performance measures, and I think at this point we're going to be going into camera. Is that correct, my staff members?
Yeah, so maybe I can just explain that what we're going to be doing is to orient the committee to the performance and quality metrics that are currently measured by Toronto Community Housing for us to consider, because of course come June 1st we're going to be responsible as a corporation for the quality of the operational performance with respect to the seniors buildings. So at a future meeting, we're going to come back as staff with a recommendation as to how we should approach that responsibility, and how the board might approach responsibility for overseeing quality and performance of the operation of the seniors buildings. And so this is an opportunity to see the kinds of things that are measured now. And we've brought two pieces of information. One is a a report that is normally constructed and provided to the board at Toronto Community Housing through their Tenant Services Committee, which looks at performance and quality. And you'll see in that report in the materials, and that's a public report, of course, because it's presented for the board for consideration and for their oversight of quality and performance. And you'll see in there that there's a number of metrics, many of which are measured across Toronto Community Housing's portfolio of buildings, and some that are broken out with respect to the seniors housing unit. In addition to that report, which is public, we have another kind of level down in terms of the kind of operational reporting that management within Toronto Community Housing looks at. And I've provided that to try and give a fuller picture of the kinds of things that are measured. That report is not a public report. It's not presented to the board, but I thought it would be helpful for this board to see how that's done within the management team at Toronto Community Housing as we look at the broad perspective of how we will go about managing performance and quality going forward. Because that report is not a public report, and our desire to kind of respect that in terms of the documents that we're receiving from Toronto Community Housing as we're getting ready for this transition, we're going to move this discussion in camera because we're going to look at what is not a public report together with the public report that goes to the board and have the discussion about how we might approach oversight of performance and quality going forward. So if the board is agreeable, board committee is agreeable, Linda, we would take a motion to go into camera at this stage.
Right, so I'm going to ask for a motion to go into camera for the next 20 minutes. Carrie?
So moved.
And Jim, and thank you, all in favor. And
to restart the live stream. I think it's resumed. I think my little thing.
Great.
So I think we're ready.
Oh, it is live, yeah.
Yeah, we're
terrific.
live.
And thank you for those of you who actually have continued to stay with us live screened. We're just going to approve the confidential report of the matters that were dealt with in the closed session, which was focused on some metrics that were shared from Toronto Community Housing. Could I have an approval for information? Thanks, Jim. Seconded. Carrie, all in favor? Thank you. And we have one more business item. We made a small change to the terms of reference at the last meeting, the terms of reference, and they are in your package and they are available. They will be on the website for everyone to see. And I think there are two highlighted points on the terms of reference that we added and we didn't get an approval on. We did actually have a discussion on it previously. And I'm just looking at it. So the first is that to work in conjunction with Toronto Community Housing on items where there's a high degree of shared responsibility and accountability between the two corporations under responsibilities, and that we would actually commit to reviewing the terms of reference every 6 months. I feel actually even just after this meeting, I have a better sense of the work ahead of us. So we may want to take a look at the terms of reference, and we can open the terms of, in my mind, terms of reference are dynamic, and that if we needed to change them before 6 months, we could do that as well.
Right.
Anything else that people wanted to add?
No.
All right, so I'm looking for an approval of our terms of reference for our quality tenant engagement committee. Thanks, Jim. Seconded. All in favor? Terrific.
So that will go back to the board for the approval. So this is a recommendation to the board for approval on the revision to the terms of reference.
Thank you. Terrific. And so they'll go to the next board meeting. And I'm looking now, unless there are any other business items, I am looking for an adjournment, a motion to adjourn. Carrie, Jim, Lawrence, all in favor. And I, although we're a small group, I actually think I just want to thank everybody. I want to thank everybody, and I'm really delighted that you joined us, Brenda. You added a lot, and I want to thank all of the staff. That every meeting like this takes a lot of people to actually bring forward the material. The material was well presented, and we really appreciate it. And we look forward to further tenant engagement, and it was terrific having Maureen on as well.
Yeah.
Thank you.
Yes, thanks very much for letting me come.
Thank you, everybody.
Thanks, everyone.
Anytime.
Bye.
Thank you.
Linda, are you staying on?
Yeah.